Welcome to the Man Cave Podcast with Dan Casper.
We got Dr. Crow on now. How you doing this morning?
I'm back.
There you Happy Pie Day, sir. So.
Yeah, I was going to say at the Crow house it's special because it's my son's birthday, so big 15-year-old at the house.
Uh-oh.
So we get extra special pie day.
Nice. Well, tell him happy birthday from us, please. So.
Will do.
Awesome. Hey, I want to start off with a guy that we've talked quite a bit about with some of our injuries, Tiger Woods. I mean, this is a guy that's gone through the gauntlet of a bunch of different injuries, and and he's kind of surprised us a lot in coming back from these. But just a few days ago, he announced that he tore his Achilles, ramping up for the golf season, which means we're not going to see him for the Masters and such. But you look at the age and you look at these injuries now, and now you got a lot of people saying, okay, this has got to be it for Tiger, but do we necessarily want to count him out at this point? But I didn't know he had torn it earlier, like in 2008 either. I don't know if it was the same Achilles or not, but factoring in everything and such, what are the odds for him to, come back at a high level at his age and his history with this? But also, does that type of injury come from because he has such a powerful swing and he puts so much pressure on his lower body, Austin?
I think certainly. I mean, you look at the constellation of injuries he had. Well, there was the car accident one that's not golf related, but I mean, his back issues, his leg that he injured, in one of the majors. I think it might have been the
U.S. Open,
whatever.
Yep.
Yeah, and I mean, all of those things. I mean, anyone who watches him swing a club is in awe, right? Just the sheer power and what he's able to do with that. So I think there's no question that's part of it. I have to say, I mean, I've taken care of a lot of Achilles ruptures in my career, and I've never seen one golfing. So it has to have some element of a pre-existing injury that was exacerbated because he did it while he was training, and so he said it was when he was kind of ramping things up. Is kind of a nebulous statement that came out, but it's a weird mechanism to tear your Achilles. But first and foremost, I mean, several times in this show I've said I don't think Tiger's coming back from this on different injuries. So I'm going to just go ahead and learn from history and say never count him out. I mean, he is a man that has just been able to push his body to the limit. But if you look at this injury in particular, I don't think it's one that's necessarily going to shut it down forever. But you also just have to start asking yourself, like, is he want to go through the rehabilitation and get back at that level again? I mean, how many times has he had to rehabilitate from scratch and build himself back up? I mean, this is probably his fourth or fifth injury that has really just been not small ones. We're talking major, potentially career-ending injuries. So at some point you have to imagine he's going to say, you know what, I think I've just had enough golf. So I think if anything, it'll be a mental checkout. Physically, I think he can come back. I mean, Achilles, if he was a basketball player, an explosive sport, I could see it being a bigger issue, but I would expect him to be able to get back physically. But again, it won't be an easy climb necessarily. But again, the question is he going to want to do this again mentally? And clearly he's a driven guy, so maybe he will. I guess that'll be something we'll have to see.
So maybe I'm trying to connect some dots here, and I don't know if this would be a factor. His gruesome leg injury was his right leg, I believe. Now, the Achilles that he just tore was his left. Could that factor in where he was putting a little too much pressure on that left?
Oh, absolutely. He's going to compensate for sure. I mean, everything he's been through, especially with the fusion on the other side, I mean, all the stuff that he's been through, absolutely his other leg sees more stress. There's no question about it. We see that time and time again in the orthopedics world. So that could play a role. Again, still an atypical mechanism to injure an Achilles like that, but clearly it went and he got it fixed, and hopefully he can bounce back. But yeah, it definitely raises questions, because then that also opens the bigger questions like, okay, so this is maybe domino number one. If he continues to compensate, what's the next thing that goes? Is he going to, rupture patellar tendon? Is he going to tear his ACL? Or, what other stress is he putting on his body? You just have to wonder, is he have the mechanics with the bad leg to fully come back? And again, that's another question that he'll have to ask himself in the recovery process.
I was listening to Dan Patrick the other day, and he brought up when Fred Couples, this was years ago, but Freddie Couples was talking about Tiger's swing and such, and he said Tiger's not going to last. That swing's not going to last, and just because of the amount of velocity and torque that he puts on his body and such. So, I mean, we praise Tiger and just, how much, he's kind of changed golf and the physical, but do we have to look, maybe, is this the cautionary tale side of things too, outside of the car accident, but with, that violent swing and that powerful swing, that this is kind of a cautionary tale for maybe some of those younger golfers, like, maybe not do exactly what Tiger does playing golf?
Yeah, I mean, I mean, if you look at across the sport world, I mean, not just in Tiger Woods, but every sport you look at, people are always trying to be the best. And the human body is not evolving at a pace fast enough where, the next generation is going to be literally bigger, faster, and stronger. So we're taking the same exact human body and trying to do things that the previous generations haven't been able to do. So whether you talk about pitchers and throwing, NFL linemen getting bigger and, bench pressing and squatting, or golfers swinging a club faster. I mean, people are pushing their bodies to the extreme. And the problem is sometimes when you push up to the cliff, you fall off the cliff. And so I think in this circumstance, you absolutely look at what he's done. And I mean, again, I think to me, the one that's the most obvious is his back issues. I mean, just the torque that he puts on with his swing. I think back to, I think it was at a majors where he did that little kind of like hook shot around a tree.
Yeah.
And it's like he almost spun out of his shoes. It's like just the sheer power he hit that ball with. I mean, yes, that is absolutely, you have to look at that and say, okay, is he doing things to his body that just isn't good long term? So, and this is, the probably the best analogy is pitchers. So, I mean, what they're trying to do is throwing the ball with velocity. I mean, there's very easy statistics you can look up as far as velocity, spin on the ball, and those are going up. And that happens simply by putting more torque through the arm, which puts stress on the elbow and the shoulder. And sure enough, what do we see? Shoulder and elbow injuries with pitchers. I mean, so at some point, if there's a pitcher who has recurrent issues, you just have to say, look, you're pushing your arm in a place it just can't go. And that's always going to be the challenge is you get these athletes that are trying to walk that fine line. Now, of course, every once in a while you get an athlete that is just built different. And these guys are. I mean, anyone who's already at that major league level, whatever sport you're talking about, they're already proven they're built different than the rest of us. They're in the 1% of the 1% of the 1%, right? But even within that cohort of people, there's people who are just one step above that, and everyone's chasing that. And so, that's something that's always going to keep me in business because people are always pushing their bodies to the extreme, and it pushes back sometimes.
Yeah, no kidding. Moving to basketball and maybe an injury that happened yesterday that will affect people's bracket picks when we get to March Madness next week. Cooper Flagg from Duke left the game with an ankle injury. Actually had to be put in a wheelchair and such. And yeah, probably not playing today. I would expect at this point. John Shire already kind of downplayed that. But I mean, now you're looking at tournament starts next week, and Duke potentially with a 1 seed. This could be the player of the year here. If it is, we talk about ankle sprains and different grades and such. If this is a very severe grade 3, I mean, is it potential he could perhaps miss the whole tournament or a huge chunk of this tournament?
Absolutely, yeah. I mean, there's ankle sprains. Like all injuries, have a large spectrum, right? So low-grade ankle sprain, he could be back for the ACC tournament. Right at the end of it, at least. On the flip side, are they out of it? I can't.
They play today. Yeah.
Game, wasn't it?
Yep.
Well, either way, so he could catch a little bit of it. Conversely, high-grade sprain, especially if there's a concomitant injury, so like let's say a cartilage injury of the talus or a peroneal tendon injury, it could absolutely be season-ending. So, I mean, you can see ankle injuries that finish a season. So, obviously seeing him go off and they put him in the wheelchair, and I think they might put him in an air cast, I mean, that certainly tells you it was not a mild sprain, probably. Of course, they're going to be very, conservative with that. So, my guess is he has an MRI scheduled for this morning, if not had one last night. So they'll have a better understanding of those things. It's going to really depend on how the next week or two goes. And so if you see him up walking around and even doing some light drills within the next week or two, he'll probably be good to go. Conversely, if he's not putting any weight on it and you see him on crutches for an extended period of time, that really suggests it was a high-grade injury. And at the end of the day, I mean, I am sure this is super important, but he's got a career ahead of him, and he is a generational talent, right? So I don't think he's going to want to try rush back and risk his career for a tournament run. I mean, I know that's the old school approach of like sell out for the team, but I just don't think athletes are doing that anymore. So they're going to have to look at the big picture as well. So my guess is they'll have an MRI today. Now, at the college level, they generally don't disclose what the MRI shows, so we probably won't know that. But you'll probably be able to tell based on what you see him doing on the sidelines for that team. So, yeah, it could be serious, but it could be relatively mild. Time will tell.
Could there, if it is serious, could there be that, and I'm blanking on the name of it, but it's that injury or that surgery you've talked about a lot too, that is it tightrope surgery?
Oh, yeah. So he could have a high ankle component. It didn't, looking at the video, it looked like more of a classic inversion injury. generally the syndesmotic injuries, which is what they do a tightrope procedure for, that's usually where the foot's going to be kind of forcefully externally rotated. His sprain didn't look like that, but that would be, again, you'd see that in the MRI. And that, I mean, there's plenty of players that have had that procedure simply to get back in a more accelerated timeline. So if it's a standard lateral or quote low ankle sprain, that's not the procedure for that. But if it is a high ankle component that's higher grade, then yes, we take that tightrope, which is basically a little metal button and a tight suture that pinches the two bones, the tibia and the fibula together. So that would be a potential if it is a high ankle component.
Before I let you go, I got to ask Gerrit Cole, the Yankees pitcher, and baseball seasons here, and we talk a lot about this injury, but he did have surgery, Tommy John surgery, and I was reading that he had a full UCL reconstruction surgery in addition to an internal brace, a Yankee spokesman says. Now, is that common to also have those two together?
We're seeing more of it, yeah. I mean, so there's a bunch of debate in the literature right now as to what route to go. And so when you look at these throwers, if there's still some intact ligament, I think people are leaning towards doing the repair, so that's the internal brace. And then if it's fully blown, then they're looking at doing the reconstruction. Now there's a couple studies that have come out that are looking at. Now these aren't really good prospective studies; they're more retrospective, so it's hard to really draw a strong conclusion. But they're looking at doing both of them together, and they're saying the timeline for recovery is accelerated. So what you do is you do the Tommy John, which is where we're drilling tunnels and putting a graft in, and once that's in place, we put anchors in that suture across there as well. So it's basically the belt and suspenders, if you will. And so the thought is that that's kind of, you're double doing it, right? It's you're giving it the extra icing on the cake. So it is a little bit more invasive surgery-wise because you're doing tunnels and anchors. But I think you may see a trend. I think that's probably going to be more prevalently done at the professional level. I think those of us taking care of high school and collegiate athletes probably won't do that quite as often, but that's still the debate when we have an athlete is like, do we talk about repair versus reconstruction? And then again, occasional, do we just throw them both at it? I've yet to do that in a patient, but I think in the right setting, you'd consider it. But yeah, I think in the next year or two, we'll probably see more studies that look at that exact thing. And at the end of the day, I mean, these guys are pitching for a job, right? And so for them, if they can get back 3 months faster and have a 5% lower retear rate, that's worth probably doing both of them.
Yeah. I mean, is it at the point, I think somebody said this, I can't remember who said the quote like this, but I mean, if you're a pitcher at some point, it almost feels like if you haven't had Tommy John surgery or, you're bound to have it or something.
Well, it's kind of like a cauliflower ear for a wrestler.
Yeah.
Every pitcher's got the scar on the inside of their elbow. Yeah, it's like part of the rite of passage. I mean, back to our initial discussion is just like these athletes pushing their bodies. I mean, they're throwing so hard, they're just destroying that UCL. I mean, that's the bottom line. I mean, these guys are throwing with such velocity and such spin. So, unfortunately, they do often push that to the extreme, and like we said, sometimes the body can't handle it.
This might be a really quick, stupid question, but like with that UCL, is it based off the velocity of the throw, the curveball, the grip, the torque on there? Is it all the above, or does one kind of lead towards more of somebody?
I think it's more velocity, velocity for sure. I think the spin to a lesser extent, but although that has been shown as well. But I think it's just the sheer velocity. I mean, these guys the number of guys that are throwing high 90s, low hundreds. I mean, it's just when we were kids, that was like unheard of, right? I mean, or almost unheard of. And now it's like, dude's throwing 101. Yeah, he's coming in. It's like you don't even bat an eye. I mean, that's just and the difference between throwing 80, 90, and 100 is like exponential, right? It's not like it's just a little different. I mean, the amount of force it takes to throw a baseball 100 miles an hour is tremendous.
Yeah, what they say, like changeups like 85 miles an hour. If they throw a fastball, it's like 92, and that's a big difference.
I mean, man, it's unreal.
Yeah, I wish I could just even get up to 50 now. So,
Oh, yeah,
that's why I don't want to do those fair, baseball throwing things where you had to like guess on the third pitch and how fast you throw because it's embarrassing now.
Yeah, no, it would be. I think your machine's broken. I was thinking that was more like 80. Like, no, you're throwing 32.